This lecture covers the first part of Chapter 14, the lymphatic and immune system, and it will give an overview of the lymphatic system. So the lymphatic system has both immune and transport components, and it serves four distinct functions. First is reabsorbing fluids from that are lost from the cardiovascular system. So the capillary beds sort of leak fluids out into the tissues and then reabsorb them in the venous part of the capillary beds. However, not all of the fluid is usually recollected, so it's the job of the lymph to take that extra fluid and bring it back to the cardiovascular system. The lymphatic system carries out an immune response, so lymphocytes circulate around and recognize foreign pathogens, and then the lymphatic tissue itself will initiate an immune response. The lymphatic system will also store and develop some of the white blood cells, specifically lymphocytes. And then the lymphatic system actually absorbs glycerol and fatty acids from the gut, from our diet, and transports these sort of fatty acid molecules throughout the body. Lymph capillaries are the smallest of the lymph vessels. They run parallel to the cardiovascular capillaries. The walls of the lymph capillaries are very permeable, even more so than the capillary beds of the cardiovascular system. And they will reabsorb excess interstitial fluid that is not reabsorbed by the capillary beds. So it's sort of like a backup plan for if not all of the fluid is reabsorbed in the cardiovascular capillary bed. Lymph fluid is also referred to as just simply lymph, and it's reabsorbed fluid within the lymphatic system. And lymph capillaries drain into lymph vessels. And these are very similar to veins in the sense that they have valves in order to direct flow back up to the cardiovascular system. The lymph vessels will then drain into lymph nodes, which are small, discrete, encapsulated bodies within the chain of the lymph vessels. They contain white blood cells called lymphocytes. So the lymph, or the fluid that is within the lymphatic system, will filter through these lymph nodes, and toxins and pathogens will be removed and destroyed. Lymph nodes are concentrated in specific regions in your neck, or in your body. So the first is in the neck, or the cervical lymph nodes. You have them concentrated in your armpits. Those are called the axillary lymph nodes. They're concentrated in your groin, or the inguinal areas. They're also in your pelvis, abdomen, thorax, and supratrochlear, so around your ear sort of region. And if you think about it, these are all areas of the body where pathogens could enter. So they're sort of clustered around those areas to help prevent foreign invaders from getting into the body. Tonsils are masses of lymphatic tissue, which are located in the pharynx. We have the palatine tonsils, which are the ones that we're used to looking at when a patient opens their mouth. There's also the lingual tonsils, which are on the back portion of your tongue, and then the adenoids, which are just posterior to the nasopharynx. Lymphatic vessels drain into the lymphatic trunks, which then empty into one of two large collecting ducts. So the first is the thoracic duct. This is the largest lymph vessel in your body. It runs from the abdomen up through the diaphragm into the left subclavian vein, and this one drains about 2/3 of the lymph in your system. And the next is the right lymphatic duct, which empties into the right subclavian vein. So lymph will flow in one direction from the tissues back to the heart, and that's because the lymph vessels have those same valves that veins do. So the spleen is a spongy sac-like mass of lymphatic tissue in the left upper quadrant of the abdomen. Part of its job is to destroy old or damaged red blood cells, but it also filters pathogens from the bloodstream. And then the thymus is located in the mediastinum, like just posterior to your sternum, and it produces T lymphocytes. And this gland is much larger in children as they are exposed to many new infections. As we get older, we are sort of re-exposed to the same sort of pathogens, and so the need for our thymus to come up with new antibodies sort of dwindles as we get older.